As far as we know, there is no relationship between the amount of voice use and the presence of vocal cord cancer. It's not produced by excessive trauma or injury to the vocal cords. Most vocal cord cancers are caused by smoking. What's interesting lately is that the smoking rates have gone down quite a bit, and what we see is that, at least in my practice, I see a lot are non-smokers who are coming in with vocal cord cancers, much more now than at least in my practice, the smokers. The thing that we're concerned about most, obviously, with patients who are coming in with hoarseness is the presence of vocal cord cancer. Whereas all the benign conditions can produce hoarseness as well, at least those are much more easily dealt with. But it's hard to distinguish somebody who comes in with hoarseness if they have cancer versus another condition unless you actually look at the vocal cords. Vocal cord cancer is actually very curable if caught early. And one of the huge advantages of vocal cord cancer, at least in terms of diagnosis, is that the symptom is fairly evident early on. Patients come in hoarse. It's really a matter of getting patients to be aware that if you're hoarse for a prolonged period of time, typically we say greater than about 2 weeks, that you ought to have somebody look. And the reason why we say 2 weeks is because if you have a cold, for example, you'll probably be hoarse for a couple of weeks. We want everybody coming in who has a cold, who's hoarse, to be checked. But if it goes beyond about 2 weeks, most professionals will say you want to get that looked at because that could be an early cancer.